Good morning, everyone. Good afternoon, and if you're in Paris, London, or Rome, good evening. I'm glad you could join us today for a little brief primer, if you will, on health, well-being, and productivity improvement in the workplace. A critical time for all of you as employers, frankly for all of us as citizens and patients, to understand what we can do to improve our health and reduce excessive healthcare costs and make our companies or organizations more successful. You know, my background is in primary care. I started in family medicine and frankly got tired of seeing diseases that didn't have to be. I went back and got a degree in public health and trained in preventive medicine to help understand both systems of care and how we could improve medical care while reducing unnecessary disease. I was fortunate after a career in the military to join one of the nation's first consumer-directed health plans. It was called Limeade. Subsequently worked with a large national carrier and now consult with a variety of healthcare organizations, employers, and really entrepreneurial startups to accelerate change faster than perhaps we're currently going. During my tenure as the president of the American College of Preventive Medicine, it actually corresponded to the run-up to the Affordable Care Act. So I got a little bit of the inside workings of how Washington works and how legislation's written. That's probably for a cup of coffee or happy hour some other time if I meet you on the road. But it's very interesting now to see as the ACA plays out and how employers are responding to it. So one caveat, these are my personal views. I don't speak for any organization, but it is perhaps from somebody who's been in the trenches, somebody who's been in organizations and trying to basically help employers meet these unprecedented challenges going forward. So our journey today will, after that brief welcome, what I want to be able to do is help you to understand what I call to be the core drivers of poor health, excessive medical costs, and lost productivity. They're by and large the same. We'll talk about those. What is a roadmap to help you understand a strategy to address those in a way that is actionable, that can be measured, and which you can report to your CEO when she asks you, what have you done for me lately to improve health, reduce medical costs, and make our company more successful? How do you actually put it into action? What are some tips going forward so that you and your partner companies and your colleagues trying to basically improve your company's performance, what can you actually do? And where does this thing called, quote-unquote, corporate wellness fit? Where has it been, and in my view, where must it go in order to be successful? And I think we'll have some time, about 10 minutes or so at the end, for question and answers. So let's start. I oftentimes have asked employers, after 15 years of doing this with them, what is your strategy to improve health and reduce costs? And after they cock their heads and look at me kind of like a deer in the headlights, they go, well, I talked to my consultant, or we're moving to a higher deductible plan, or we're going any number of what I would call short-term Band-Aids rather than an overarching strategy to address the drivers of health and productivity and to move the organization forward. So the goal today is to give you a framework which is generic, it's applicable to every company of every size in every geography in the country and actually around the world, although it's got American features, to help you crisply understand a strategy that you may be able to employ in your company going forward. I love pictures. We're visual by nature. So here we've got an overweight patient and an equally overweight doctor in a harried 15-minute visit, undoubtedly in some type of value-based payment plan. Give it to me straight, doc. How long do I have to ignore your advice? And I jokingly say, this, by and large, is how we spend nearly 20% of the GDP, now $3 trillion on health care. 75% of costs, premature death, disease, and disability is absolutely due to 3 or 4 health behaviors that we've now medicalized. 30% at least of that $2.8 or $3 trillion is pure waste, ineffective, inefficient care, and absolutely both of those numbers are probably an underestimate. Some knowledgeable sources would say 90% of costs are due to health or behaviors and environment, and 62%, if you believe some large national consulting houses, is ineffective and inefficient care. Imagine if any core business in your company had these types of numbers, how quickly it would be addressed. That's what we want to do. I want to take a strategy to address these two numbers, 75% due to behaviors and 30% wasteful healthcare spending. What are we trying to do anyway? If we don't address these two numbers, we might as well be whistling Dixie. Now, Wendy Lynch and Bruce Sherman, Bruce used to be the medical director of Whirlpool and is a national authority and colleague, as is Wendy, said that workplace culture absolutely shapes everything you might want to do in a health and wellness program, everything you might want to do in a healthy workforce, everything you might want to do in disability or workers' comp. And these are the elements of a healthy workplace culture which you have to understand and be honest and assess in your organization. So workplace practices, the well-being status of your employees, work factors that impact them at their desk, in the plant, on the way to and from work. What is their own sense of their individual well-being? How about their own individual performance? Do they have any awareness of what their individual performance is? And how do you track at the organizational level a business unit performance such that it mirrors and reflects the best individual performance that the employees can exhibit in order to meet your organization's goal? Culture trumps anything, and your organization, your company has a culture. It may not be explicit, but you have to understand it. It's business anthropology, and it's the cornerstone of everything we're going to be talking about today. No amount of short-term tactics can change a culture unless you face up to what the culture really is. And this is probably the forgotten element of many of the employer strategies that I've seen over the years of doing this. The Institute of Medicine published a monograph about 6 or 7 years ago for NASA. And the case definition, to use a medical word, is how do you know if you have a healthy workforce or not? What are the criteria, measurable criteria that every employer should be able to measure to understand whether or not they have the highest performing workforce, the healthiest workforce they can have? And there's 4 elements: healthy, productive, ready, and resilient. So does your workforce exhibit the minimal preventable illness and injury that's possible? Are they productive? Do they contribute to the corporate mission and achieve their own personal goals? Productivity is not a nasty word. It actually expresses the goal of the company and the goal of myself as a citizen, as a father, as a spouse, as a community member. How do people achieve and define those goals? Companies increasingly are responding to dramatic and ever-changing demands. Is your employee workforce ready if demand dries up tomorrow or if there's a sudden setback in the marketplace? And how quickly after a setback, because you'll always have setbacks, does the workforce bounce back? Healthy, productive, ready, resilient. All of these can be measured. They can be measured in metrics you already have, or they can be measured actually in the supervisor's assessment of the people that he or she supervises. You know when Bob is having a bad day long before he's absent from work. The concepts of presenteeism, which precede absenteeism, are deeply known by your supervisors and your peer workers. We rarely tap into them and allow them to get free so that we can act on them. Now, in a bigger model, we talk about the determinants of health as being where and how we live, learn, work, and play. Those simple 4 words took over 2 years of a Robert Wood Johnson Foundation commission to describe, in our own words, if you will, the determinants of health in American society. I've italicized the word work here because for adults, the biggest and most prolonged and prominent influence on their life is the workforce, is the workplace, is the employer relationship. You as employers have the biggest single influence on many of these factors: the social environment, the physical environment, yes, even the genetic environment. We'll talk about that at the end of the talk. The response to stress, the well-being of the employees and what they bring to the home in terms of impacting their spouse and their children and the community. Never underestimate the power you have as an employer. You are the most dominant influence in most of your employees and their families' lives. The determinants of health model predicts that. The question is, how can we leverage that going forward to maximal effect? Now on slide 9, this slide, which is, at least on my view, I apologize, is not showing up. But there is essentially a histogram that shows essentially the 30-year work of D. Eddington, which many of you are familiar with. I come back to his simple mantra after following 2.5 million employee lives for the better part of 30 years, that health behaviors in the end drive all costs. Not by themselves, but they are an absolute critical marker to improve the health of the population, reduce excessive medical costs, and total productivity costs. So people who have healthy behaviors or low health risks of 12 common risk factors, which many of you measure in health assessments, over their lifetime have the lowest medical costs, the lowest disability costs, the lowest absenteeism, the lowest worker comp, and the lowest total employer costs. So our goal as employers is clearly to keep the low-risk population low. And in accordance with risk, medium risk and highest risk people spend the most on medical costs, disability, absenteeism, workers' comp, and total employer costs. So the goal is to keep low-risk people low in your employee population and help the people of highest and medium risk to move to lowest risk. It is possible. It's being done by leading employers. And the question is, when do I see the returns? The first returns you will see are loyalty and trust in the leadership of the company that oftentimes comes in employee surveys. You care enough about my family's health that you help my spouse reduce stress, improve her health, lower weight, take better care of her child's asthma. All of these factors are big in increasing trust and satisfaction in the eyes of the employee if done properly. The second marker you'll see is absenteeism. Absenteeism actually decreases with a well-run wellness program. And the lagging indicator, frankly, is medical care costs. Generally 18 to 36 months is about as soon as you see it from a traditional wellness program. But that still is huge to prevent the upward flow of risk and the upward flow of costs. Let's talk about, that's the 30% number. We've known for many years where ineffective and inefficient healthcare services live, and I've listed them here. Unnecessary services, inefficiently delivered, excessive costs with excessive prices, largely secretive or not clear to the real consumer, which is the patient, missed prevention opportunities for even the things that we know save lives. Free isn't free enough. Most employers that I believe to be successful, they incentivize preventive services above and beyond making them free. Even when colonoscopies are free, you get utilization of 60 to 70% in men and women above the age of 50 who absolutely need that test for the number 2 cause of cancer death in the country. And certainly we can do better policing fraudulent practices in healthcare. These numbers are real, and I personally believe the 30% number is an underestimate. What is your strategy as an employer to help your employees understand where this inefficient care lives, avoid spending that money? It all comes from their pocket one way or another, in lowered compensation and benefits. Most American companies have had zero pay increase in the past 15 years. It's all gone into quote-unquote healthcare benefits. The consumer has been insulated from these prices, from these poor practices. What is your strategy to make your employees and their families more aware of them so they can become a better consumer of healthcare services? Furthermore, does your selection of providers, doctors, hospitals include these considerations? Who is the most efficient? Who delivers the most unnecessary services, the most effective services in a customer-employee-centric way? So whether you're engaging your providers or engaging your employees and their families, understanding ineffective, inefficient care is job one in developing an effective strategy. Why a roadmap? The term roadmap was chosen deliberately. If I don't know where I'm going and I don't know where I am, it's very hard to get to my destination. A roadmap implies a direction. It implies a goal. It implies a vision of the place that I want to be. I believe that the roadmap is a very, very good analogy for creating a strategy for all employers to move forward in this very difficult and competitive environment. And here it is. A couple of comments about the Employer Health and Productivity Roadmap. I was fortunate to develop this along with colleagues at the UPMC Health Plan in Pittsburgh, where I serve as Senior Medical Director. The roadmap was first presented at a national meeting sponsored by the National Institute of Occupational Safety and Health on total worker health as a national best practice model by the committee to help employers understand the core drivers of poor health, excessive medical costs, and lost productivity. The reference here, and you'll have copies of these slides if you want to pull up the original manuscript with all of the attached metrics, was published in the December 2013 Journal of Occupational and Environmental Medicine. As I said before, the roadmap is generic. Every employer should be able to do this in partnership with its various plans and or provider systems, and it's something that is actionable today. I'm going to go through at a very high level each one of the 6 elements, if you will. I like to think of this as a 6-cylinder car. You can get a car to drive on 2 cylinders, but it won't be a high-performing car. Unless you address all 6 elements, all 6 cylinders of this high-performing health and productivity roadmap, I will tell you that in my estimation and in other national experts, you can't be the highest performing company that you want to be. So with that, what we'll do is go through each of the elements one by one, and I'll give you a high-level review of what the elements are. You might note on this slide that the 4 innermost elements are what I call the engine room of the model. The ones in green: increase healthy behaviors, minimize acute care, optimize chronic care, and reduce excessive surgery, are those that are powered by full replacement, consumer-directed health plans done right, or significantly incentivized deductible buy-down plans. The other 2 elements in purple, outside the green, are things that traditionally lie outside of the traditional health benefit space, but are critically important to make the model succeed. How do you proceed and put it into action? Well, let's talk about the elements. Element number 1, optimize the environment. Remember when I talked about the Wendy Lintz Bruce Sherman model? Unless you understand the culture, a frank assessment of the programs and health resources that you provide, and the roles, responsibilities, and rewards that you expect of your employees, either directly or oftentimes you undermine them with other types of behaviors and policies in your company, you cannot have a high-performing workforce. Is your disability policy aligned with your wellness programs? Is your return to work policy aligned with what you do or would like to have happen in workers' comp? Do you pay people more when they contribute more? Do you have gain sharing or profit sharing plans? Do you collaborate with other people in the company in terms of your policy and leadership so that people feel they're part of a valued team? If the answer to some of these is all no, it's going to be very hard to build trust in a wellness or a health strategy that works, because your employees are getting conflicting messages as it relates to these various elements. Why is this important? Companies that have an optimal culture and optimize the environment and align the rewards and responsibilities at the employee level have lower medical costs, fewer short-term disability costs, lower worker comp, decreased turnover, all the things that the head of HR and the CEO of the company wants. By the way, the top-line revenue is even greater. So whether it's reducing your bottom-line losses or increasing your top-line revenue, optimizing the environment using many tools that are already in the marketplace, you could ask your consultant, you can work with others around how do I assess the culture of my company around optimizing the environment. These are things you need to know because they can be barriers to successful wellness programs and cost mitigation. The second element, addressing that 75%. How do you increase healthy behaviors? Oftentimes, there are 3 elements to any successful behavior change. One is I have to know that it's important. We give short shrift to this. Telling somebody to lose weight because it's going to kill them is not a knowledge base that motivates anybody. Number 2, I have to have a different skill set than what I currently do. And number 3, what is my reinforcing support system in terms of people and environment so that the right thing becomes the consistent thing to do? Knowledge, skills, supportive environment, and people to say, attaboy, attagirl, or you could have done better, Bob, all very important. And yes, major areas like tobacco cessation, physical activity, stress management, and weight management are critically important to be able to create the cornerstone of healthy behaviors in the entire population to keep the low-risk people low and move those high and medium risk to lower risk. Element number 3, minimize acute care. There has been a revolution in what I would call nuisance visits over the last 5 years. Not only are people with healthy habits experiencing fewer episodes of acute care which require medical attention, but when I do require medical attention for 20 or 30 common outpatient visits, more often than not, I can now access them with new technology or on-site clinics in the workplace. And these are disrupting, in many cases, the traditional primary care physician relationship. But the good news is leading primary care physicians are accessing these technologies to extend their reach and provide greater access and care coordination. So traditional and alternative care visits should be tracked. You should keep track of how many visits that were done face-to-face could be done virtually using a tethered electronic medical record or some other type of easy-to-use 24/7 virtual visit service. Should you consider an on-site care option? How about on-site coaching? And what are the prevalence of these acute care visits over time? If the health of the population is improving, the prevalence of these visits should be going down. Again, I refer you to the 2013 JOEM article for the actual metrics in each one of these elements, but those are representative metrics that we would use in the minimize acute care bucket. Optimize chronic care, element number 4. This is where all your cost is. That 5 to 10% of your employees who consume 70 to 80% of all healthcare costs, they don't understand their asthma, their diabetes, their hypertension, their hypercholesterolemia, their kidney disease. So are you tracking the prevalence of these conditions in your population year over year? How are these patients identified? Do you have an active referral process where you encourage them with incentives to call in and seek help, to ask their doctor, or to find doctors who prescribe behavior change as part of their care plan? Do you have coaching programs in place, online, in groups, over the phone, to address the 5 or 6 most common chronic conditions so that you can put people in charge of their care and make them more activated? Coaching has 4 or 5 common elements. Ask the question of your coaching programs about readiness to change. Patients need to be able to set easy, low-level goals and begin to become successful. Most patients believe deep down that they're failures, or it's too hard to do, I can never understand what my doctor says, and I certainly can't do it. Coaching is important in creating a pathway to success, small steps that become big achievements. Helping the patient solve problems, helping them become more self-efficacious, providing that support system from a trusted coach who can be right down the hall or can't even be an employee who lost weight themselves. Making those skills second nature and then reinforcing them, using these skills as they engage their doctors to become more activated because they will have a better outcome. This slide lists the typical areas that you should have access to as an enlightened employer with all of your partner companies to provide an end-to-end solution for lifestyle improvement, chronic disease self-mastery, and engagement with physicians and shared decision support, which I'll talk about here in a minute. All of these programs should have multiple modalities, ideally. Many of them can be free or found online. Many of them can be done with your health plan or other type of partner. Many of them can be done through the resources of companies such as Limeade, which I think is excellent in finding engaging, fun, competitive, peer-to-peer, and group support for behavior change that oftentimes is not reinforced in the environments we live in. A hidden cost that employers have not really realized until recently is how much is spent on preference-sensitive surgeries and on high-cost procedures. Many estimates have shown that the average employer is spending nearly 30% of total healthcare spend on these surgeries and high-cost procedures. Yet we've known for nearly 15 or 20 years that when patients are fully informed about the pros and cons of these surgeries and the pros and cons of the procedures with decision aids, that they actually self-select to say, doctor, I think I'll pass, I'll wait, or I will try this lifestyle, physical therapy, or medication approach versus surgery. So ensuring that your employees and their family members are aware of their options and they're engaged with their physicians in shared decision-making is element number 5 of the roadmap. So you should be tracking the number and types of these types of surgeries, the number and types of advanced imaging, which is oftentimes a precursor to getting these types of surgeries, And be aware of the 7 or so discretionary surgery groups that are typically very amenable to these types of shared decision-making processes and decision aids. Very important because essentially patients make very different decisions than their doctors oftentimes think they will make. This slide is one of my favorites. It's a small-scale study, only 460 physicians done a few years ago, but they went to the physicians and they asked them in the green bars, is it really important for your patients to be informed about cancer screenings, surgery, taking a new prescription drug, changing behaviors, or managing any number of chronic conditions? You can see from the green bars that run horizontally that 80 to 90% of the time, doctors said, absolutely, it's important that my patients be fully informed about their options for all of these categories of care. They then flipped the survey around and said, well, doctor, let me ask you this. How many of your patients are adequately informed about all of these areas? Hence the blue bars. Only 10 to 20% of the time did they say their very own patients that they were taking care of had been informed adequately about all these procedures. This is what we have to do as employers, is to close this gap. Now, to be fair, many of us in health systems and many of us working as physicians and many of us working in large centers of care are trying to close this gap as fast as we can, but this is where important, innovative platforms that provide information on transparency and engagement and connecting patients with patients can close this gap very quickly. So there's many online tools, there's many other resources in your community, but this gap is costly in terms of unnecessary care, unnecessary cost, medical errors, and safety. And I think it's a very representative slide that tells us what we need to do together is to close the gap around informing patients. That's element number 5. Our goal in the end is to create employees who are activated in the care process. Whether they're a consumer or whether they're a patient, activation matters. Better health behaviors, better care, better clinical outcomes, and, oh yes, lower cost. So if you've heard of the patient assessment measure, patient activation measure by Judy Hibbert at the University of Oregon, or now the Altarum consumer engagement tool, Wendy Lynch and colleagues at Safeway developed that tool. It's now available. These tools should be incorporated into every employer suite to help inform employees that the lack of activation is a risk factor not only to their health but also to their pocketbook. So activation can be measured and it should be improved over time. The final element of the roadmap is what happens to the patient after they're sick, after they hurt their knee, after they had the surgery. Who's got their back, literally, in getting them back to work? And what's the cycle time? Cycle time is a term that employers use all the time in manufacturing or engineering. What is the cycle time to get Bob, a critical employee, back to fully functioning at work? We rarely look at that. We look at our benefits programs as stovepipes, not as employee-centric continuum, and that's why we have to monitor all of these measures: absenteeism, poor work performance, when we physically get Bob back and when he's fully up to speed. We typically don't do this, but yet it's a major cost center, an area of lost productivity, because we're not monitoring care transitions or transitions between benefit stovepipes. A couple of closing thoughts on where corporate wellness fits in. Some of my colleagues know recently I don't like the term wellness, not because it's a bad word, but because it's not comprehensive enough. Language is important. Semantics are critical. I increasingly like the term health, safety, and performance rather than wellness. There's not a line manager in any company I've ever been to who doesn't understand the word safety, who doesn't understand the word earnings per share as performance. Linking health to safety and performance, which is the entire thrust of the NIOSH Total Worker Health Program, is important. So increasingly we're moving from wellness, which is awareness, to participation and to outcomes. How is that happening? Well, leading employers, many of you on the phone, folks who are partnering with Limeade, get it. You have got to support and reward the behavior change that leads to meaningful outcomes for the employees, for the employee's family, which leads to the corporate good that comes about. What are the tools and resources that you make easy and accessible? Point of decision. Do you make people aware of their health status, of their health behaviors, and get them to know their numbers? Even though people might have been going for physicals to doctors for years, I'm always struck by how few of them actually know their blood pressure. Do they know that 130 is really not normal? It's slightly elevated. I want it below 120. I want it below 120 over 80 to be optimal. That's what you bring with biometric screenings to the forefront. And then finally, do you have interventions which are meaningful, easy, engaging, rewarding, incentivized? Wellness programs are becoming end-to-end incentivized health management programs for everybody on the continuum of care, not just the people concerned about the 12 health behaviors or risk factors that my good friend and colleague Dee Eddington defined some 35 years ago. It's moved deeply into the care management space using the same types of strategies, which can be very effective. Technology is constantly changing. There's literally billions going into patient and consumer-centric technologies, and it all corners on engagement. Engagement has to be seen as a family function, not an employee function. Employees and families want it their way. As many of you who might have heard me talk, I don't like Burger King's food. No pun intended, but I love their slogan, have it your way. Employees want it their way, their time, served up to them in their busy lives. And our job is to use technology as well as high-touch resources to change the game so that they get more engaged. All of the things you see, mobile devices, self-monitoring, biofeedback, virtual coaching, are increasingly being embraced by physicians, by provider systems, and by health plans to get higher levels of engagement, which in the end is the currency of the realm. Even Medicare is using sophisticated models of behavioral economics like nudge messaging, loss aversion, commitment contracts, peer support. No longer are incentives defined as a $50 check or gift card for completing a health assessment. These are principles deeply embedded in behavioral economics, which you should be talking to your partners about. How do we leverage these things that we know drive and change human behavior to get a better outcome sooner than waiting for the typical cycle time that we have currently in health, care management, and optimization? Remember those 4 cylinders in the middle of the health and productivity roadmap? Consumer-directed health care, preferably full replacement health savings account with monies deposited by the employer and additional incentives to understand, improve, and partner with your doctor to do the things in those 4 inner elements. That is the most powerful way to get your employees to say, it's my health, it's my money, the choices I make about what I eat and the doctors I go to really matter. I'm going to take care of both. So if you're not moving towards a full replacement, enlightened, consumer-directed health plan, I would encourage you to consider it because the data is no longer questionable. It's in. It can work across the full spectrum of care and care needs if properly designed. You just need to kind of have a strategy to open the books, show your employees what health care is costing, and get them more engaged. At the end of the day, it's really what I eat, how I move, and what I think. As I've gotten older in my medical career, whole food plant-based diets to reverse or stop the inflammatory diseases that affect multiple organs in the body, with physical activity, getting away from the terminal, getting off the cell phone, getting outside, getting that 30 minutes to an hour of physical activity a day, and having a positive self-attitude based on a sense of linkage, purpose, community, commitment. This is the 3-legged stool of good health and actually disease management. If you cannot do these 3 things, there's no amount of pills, stents, bypasses that can fix you. I'm shortening it a little bit, but it's absolutely true. The whole person approach, thinking about the family in the middle, making their time the most valuable resource, not our time, is the key. So whether it's worksite health programs, benefit designs that are aligned and incentivized to do the right thing, clinical programs that make sense with partners that get what you want, it all starts with this whole person approach. One of my favorite quotes is what I call the genetic cop-out. Everybody in my family gets diabetes. No, it's not that everybody in your family gets diabetes, heart disease, and obesity. True, it runs in your family, but that's because no one runs in your family. And I have to admit that I was a little depressed, but challenged by the announcement last week. Congratulations, it's now true. based on the National Health and Nutrition Examination Survey, 50%, 50% of all Americans are either diabetic or pre-diabetic. Let me repeat that. 50%, one half, every other person that you meet walking down the street is either diabetic or pre-diabetic. It has nothing to do with our genes. 91% of diabetes in this country is type 2 diabetes. Our genes may load the gun, but the environment and our behavior pulls the trigger. So the magnitude of what we have to address is huge. But I believe using the roadmap and using leaders like you on the phone that we're going to be able to address that in a strategic way, step by step, with measures that matter. So with that, Jory, I'll turn it back to you, and I believe we have some time for some comments, questions. I hope this has stimulated some thoughts from our audience.
Yes, thank you so much, Dr. Parkinson. That was great. So if you have any questions, we've seen a few come through, but feel free to continue adding them to the question box. And we've also uploaded the slides to limeade.com. So if you head over there, you'll see the slides, and we'll also be emailing them to you with the recording as well later this week. So the first question I have here is from Stephen. He wants to know, what is the real primary driver for optimal health in the workplace? You talked about many different types of drivers, but is there any that you might put at the top of the list?
You know, I could have an opinion, but I'm always I always sometimes don't like to distinguish my opinion from what the literature would show. I think there's really two things. One is corporate culture. I think as a wellness industry, or as physicians or practitioners of health promotion, we have underestimated the overarching power and influence of the culture at work. A toxic supervisor who treats me poorly can undermine any wellness program that I might want to put in place. Choosing the right mid-level managers, senior-level leadership is critical to creating a culture of health and productivity. And even if you have all the papers that look right and all the programs that look good, if you don't have a corporate assessment that says the way we hire people, the way we promote people, the way we acknowledge people, the way we try to align their responsibilities and their rewards for achievement, I think that's been the aha moment for me over the last 10 or 15 years. That can overwhelm anything as it relates to a wellness program. Number two, I would say the other driver, the underappreciated driver is the reluctance. I mean, it's not a driver, but it's basically a barrier. The reluctance of many corporate leaders to what I say, open the books. There's only one bucket of money, but yet we keep it from the employees. We don't tell them what the total cost of their health care benefit really was. We don't share with them that a Z-Pak is a very expensive drug that you shouldn't be taking most of the time. We don't show them or explain to them why salary has been flat to declining. It's because the average premium has gone up 5, 10, 15% a year for each of the last 10 years. And I think that hurts us in the migration to a responsible health, wellness, and care management program. So those are two perspectives on drivers that I would just want to foot stomp on a little bit. Perhaps that helps.
Thank you. And then Michelle had a good follow-up question. Some of the topics that we discussed can be really sensitive to employees. So how can you bring some of these matters up without offending anyone?
You know, that's a good question. I mean, one of the areas I didn't speak about much is the most underutilized program in American corporate history. It's called EAP. The stigmatization, which is unfortunate for employee assistance programs, particularly when in any given employee population, frankly, 25 or 30% will admit that they are totally stressed out and overwhelmed by life challenges, but yet you find 1 to 2% of people using the EAP program. I think that 25 to 30% is actually an underestimate. It's probably closer to 50 to 60%. We know that 60% of patients with chronic disease admit to being depressed or anxious, which gets in the way of their care management. So I frankly believe showing a willingness to really listen to employees and to connect the dots between underutilized benefit programs and their needs actually allows employers to open a door to frankness that employees really appreciate. These are all, but the interesting thing to me is that the leadership of companies, oftentimes they're just people like the employees and the mid-level supervisors in a company, telling some stories of personal success, of individuals who've met a challenge, who overcome it, and maybe even who fell back and overcame it again is absolutely important. So many of the companies I work with and that we work with, I'm very determined to find me a champion in the manufacturing plant. Find me a champion in the HR suite. Find me a champion in the cafeteria who met a personal challenge, basically had a stressful situation, and emerged the other end more resilient and wants to tell his or her colleagues about it. Telling stories and being open can overcome any of these so-called sensitive issues, and then people will begin to maximize the use of some of these programs that even if they work, people don't use because they're stigmatized, they don't know how to access them, and they don't think they work because they've never heard a testimonial from someone who had a better outcome.
Thank you. That was great. John had a good follow-up question that I think fits into this. How do you see telemedicine in the workplace as one of the contributing factors to reducing these healthcare costs and promoting better health overall?
Joe, that's a great point. I did mention that I had the privilege of serving in the military for a number of years, and there was a mantra that we used, which was part of that wasn't doctrine, but it was the practice when we knew we could save lives, and that was very simply stated as move care forward, meaning don't build bigger hospitals, but move the care into the battlefield where it's most needed immediately so it can be most effective, and there you can save lives. So if you think about that mantra for a minute, not only move care, but move caring forward. Where is the forward location in a company? It's in the work site. It's right there on the floor of the manufacturing plant, right? So if you can move as much caring around busy people into the place where they spend 8 or 9 or 10 hours a day, which is the work site, the more effective and more welcome it will be. On-site health coaching, you typically get tenfold the engagement as opposed to over the phone with somebody who is relatively faceless. They may be known to you, but it's not the same as having Karen or Bob who's right down the hall. So anything you can do to connect the work site to health care or caring in the form of coaching will be more effective. Telehealth and telemedicine does that. So there's nothing at all wrong. As a matter of fact, you'd be encouraged to bring telehealth into the work site. The typical level for an on-site clinic, many of you know, is about 1,500 employees per location in terms of the break-even number and traditional types of acute care visits. But with telehealth, I foresee us, and particularly with virtual visits, which now many health systems are offering broadly, it is a huge extender. Why employers like this is they're saving 4 to 5 hours of work time because the employee's not leaving work. It's real savings if they don't have to go downtown, find a parking space, and hope there's an office open. Also, you should use telehealth and ask of your providers, are they providing that service so that your employees can stay connected with their existing primary care physicians or their specialists if they have one? Many systems are now offering that. So absolutely, great question. Telehealth is a care and caring extender, and I see a lot of potential for it in the worksite.
Thank you. Jane has a different question. So companies that may be able to afford telehealth have probably a bigger wellness budget. But do you have any ideas for how to implement these ideas? A company may not have a budget that allows for these additional expenses to promote healthier work environments?
Well, let me distinguish a little bit between the last comment on telehealth and the questioner's comment. Telehealth now is being consumerized, meaning for 20 or 30 of the most common visits that oftentimes go to an urgent center, oftentimes go to the primary care, or even worse if they wind up in the ER and the company ends up paying for that, can now be consumerized. So one of the first things I would ask, most employers should be able to access either a cell phone mediated or a computer mediated virtual visit, and they're very, very affordable. So even if I'm a small employer, I may not be able to put a telehealth unit into my office, but I can absolutely make sure that all of my employees and all of their spouses can access consumer-facing applications where they can get virtual visits. So and they can do that while they're at work. So again, I'm still saving that 4 to 5 hours of when they would leave work. the cost of traditional wellness programs, there's many new partners out there in this space, has actually dropped, and there's more and more ways to link to community resources to do many of the things you want to do. I would give a quick, very brief story in that a traditional way of understanding and improving and then partnering with your doctor is a mantra that I've used for quite a while. But realistically speaking, if behavior drives most of the costs, how do you get people doing behaviors first and then worry about some of the architecture of a wellness program later? So if I could get people to a simple wellness website and I could just start by my own behavior, making it the culture of my company that we move more when we come to work, I actually am making progress on the improve part before I spend a lot of money on the understand part. One company that I actually got to know outside of Richmond, Virginia, had a very, very heavily dominant sedentary workforce. And the new head of HR for this company, who happened to be a Navy SEAL, said, we can't afford a so-called wellness program, but what I do know is everybody's going to feel better, they'll be more focused in work if we just get walking. And so we instituted a morning walking program, same time, same day, every single day, and basically esprit de corps went up, people started losing weight, they felt better. That's the purpose of a wellness program. So think creatively. You don't have to do the typical out-of-the-box programmatic wellness programs in order to be successful and get engagement.
We just had a quick question from Amy. She wanted to know, what was that percentage of type 2 diabetes compared to type 1, as a clarification?
Sure. 91% of diabetes is what we used to call it adult onset diabetes when I was in medical school. I'm dating myself because only adults got it. But we had to eliminate that because we now have teenagers getting it. So type 1 is the insulin deficiency type of diabetes that almost always requires insulin injections. Type 2 is what we're having an epidemic of type 2 diabetes, 91%. And in many countries that eat a plant-based diet and are physically active and are not overweight, you don't see it at all. It's a Western disease, essentially, and that's what we're seeing, dramatic rises such that 50% of Americans now are either diabetic or pre-diabetic. National Health and Nutrition Education Survey. Google it. It's pretty sad. But that's what we have to deal with, and we can with integrated programs with incentives and people helping people.
Wow, it's kind of unbelievable. John had a great question to end on. How does financial and emotional wellness fit into this thinking about health, traditional health wellness?
What's interesting is that many of the reasons that wellness programs, I would say, fail and that health coaching fails is that we're not tuned into the emotional needs of the people on the other end of the phone or our coworker or somebody that we're supervising, and we really don't take the time to understand where they are. And I mean that what their emotional status is and what their life situation is. Similarly, what we know is that if people are worried about feeding their children or putting a roof over their mouth, their financial status is in jeopardy. That is a huge deterrent for them losing weight, asking more questions of their doctor, or being activated. So one of the things that, if I can go back to the early days of why we put such things as health savings accounts into place, in the early years when they were first approved, was the alignment of financial incentives. Think about it a minute. I don't go all the time to Walmart, but I love Walmart's slogan, save money, live better. If I have more money, I have more discretionary income to be able to do the things that are important to me and my family. If I become a better consumer of health care, I should have more money in my pocket than somebody who is not a good consumer of health care. So making sure that we understand people's self-attitude, their self-efficacy, do they think they can change or not? So the patient activation tools we talked about, the consumer activation tools, if I don't think I'm capable of change, my emotional status, if my self-reflection, my self-efficacy is nil, and if I'm stressed financially, it's going to be very hard for me to be a successful participant in a wellness program, ask questions of my doctor, to really become a healthier person who's a more productive member of my company, right? So that's why I mentioned the underutilized programs like EAP, which should be about stress and resiliency building, as opposed to the way they've traditionally been seen as, well, that's where the broken or weak people go. Reframing those programs and helping people address those challenges, turning them into winners. What can you do for employees who, my other brother oftentimes says, we're all broken just in different ways. So how can we accept the fact that all of us could be better emotionally, and that if we begin to heal ourselves with help from others in terms of understanding our stresses, being more resilient, that in turn allows us to be on a small pathway to success that in the end financially should be aligned with what we're doing better. If I'm less ill, I spend less money. If I make better medical decisions, there's less money that I spend. Therefore, I should be getting, at the employer level, I should be getting some salary increases. It shouldn't all be going into healthcare costs. That's our hope, and that's what the roadmap is kind of directed towards. So, Joy, I want to thank you and all the listeners today for the attention. Again, this is a high-level strategy. I refer you back to the Journal of Occupational Environmental Medicine if you'd like to see the entire article. But I appreciate working with Limeade and the fact that you all tuned in with us today. Jory, over to you.